Hello, everyone. Welcome to another special webinar for LAMP students. Tongue diagnosis made easy, and we shall continue discussion of the pale tongues with the depression at their root. Okay, when you say uh, deficiency of the stomach chi, which I mentioned earlier, no, there is no root of the coating. Okay, rootless coating or coating without root. Or when you have stomach yin, actually, this is the start of stomach yin deficiency. When your coating doesn't have a root anymore. Okay? Hindi na siya rooted. And kidney yin deficiency. So, in these cases, you do not expect to see a coating. You expect to see a coating, but they are rootless. And the coating is uneven, the distribution is uneven, and this will give the appearance of as if it is luma, old, no? And looks as if it could be easily scraped off. Okay? Okay, so if there is lack of tongue coating, plus the tongue body is pale, lack means hindi pa total absence, kulang lang yung coating, and the tongue body is pale, that means you have stomach chi deficiency or lack of stomach chi. Remember, the coating of the tongue will actually tell us about the yang, particularly the stomach. So this combination, lack of tongue coating and the tongue body is pale, plus if you see superficial cracks in the center, that means you are now, your fluids are now declining and the stomach yin is also declining. Okay? This is the onset of decline in fluids and stomach yin, which is so logical because if you see cracks in the center of the tongue, we always think of dehydration, right? So that is the start of the decline in fluids and stomach yin. Okay, now let's go to the root of the tongue. Don't confuse this with tongue coating without root. The root of the tongue is the posterior third of the tongue. And we refer to this as the lower burner. And the king, of course, is the kidney. Although we also look at the coating at the root. Okay? So every time we talk about the coating, we're referring to the condition of the yang organs. So at the root of the tongue, we think of the small and large intestine and the bladder. Okay? So we do not talk about the kidney. We talk about the bladder when we talk about the coating. So if there's no coating, we talk about kidney yin deficiency. Okay? So if you want to assess the tongue coating at the root of the tongue or the posterior third of the tongue, we're actually assessing the condition of the yang organs, no? So the stomach is on the middle third, as well as the gallbladder, the other side, no? So complete interpretation of the coating at the root requires knowledge of the patient's symptoms. Okay? You need to know the patient's symptoms. So we just don't put the picture of the tongue or take a picture of the tongue. You should know the symptoms. Okay, if there is absence of coating, remember this is different from lack of coating. There's no coating at the root of the tongue, or the root of the tongue is red. That means you already have kidney yin deficiency. Remember, no coating. That's yin deficiency. Okay, and exhaustion of body fluids. Okay. Very red and dry root, that means there is fire. Kidney fire from kidney yin deficiency. So this is empty heat. Okay. Texture and form of the root of the tongue will tell us the condition of the kidney. Okay. The texture, remember the texture and the form or the shape at the root of the tongue. Okay? The condition of the kidney. So if you see that the root is contracted or forms a depression at the root, forms a letter V. Ayan, ganun ba yung V? Yeah, okay. That means you have Jing deficiency or essence deficiency. That means you look older than your age, or you have balding, okay? Or you're beginning to lose your teeth, or your bones are brittle, okay? Tongue shapes are the result of loss of substance or material. So, in which the tongue will lack appropriate volume or shape. If the tongue root color is normal, the deficiency is not yet advanced to the stage of internal heat. So, what should be the color? It should be so internal heat means it came from the internal, no? The yin deficiency. Okay. So as long as the color of the root is normal, that means it is not yet advanced stage of internal heat. That's still deficiency. So if you have an incipient essence deficiency, you will have a pale tongue. So it's not yet red, pa, no? With a depression at the root. So this is just like saying there is lack of substance to fill the root of the tongue. So you will be experiencing symptoms of qi deficiency. What are they? Fatigue, lack of appetite, sweating. You sweat easily upon slightest exertion. No? Konting effort lang, pinapawisan ka na. And of course, loose stools. So we're talking about the spleen here and the lungs. Yes? Now you know. Plus, you have symptoms that indicate essence deficiency, brittle bones, lack of uh, falling hair na, or balding, and um, what else? Loss of teeth. The fatigue may evolve into exhaustion, and this is not alleviated by regular sleep. So there are people who would always complain, why is it that I slept the whole day the day prior? You still have tiredness, you still have fatigue. I want to be na. Okay. Lack of concentration, failure of memory. So yung mga paulit-ulit, hindi pa rin ma-memorize. And the head hair may turn prematurely gray. Okay?
Ako yan do.
Okay. Thank you for inunahan mo na kami. Hindi naman namin sinasadya. So remember, lack of concentration, failure of memory. So you have to consult your associate. No, you have to go to Cadiz. Miss Bacolod, no? So it is not enough to just tonify the chi. You should also nourish the essence, the kidney yin, and the yang. Okay? Now, why does the essence weaken? It's because of our hectic lifestyle. If you have a Hector, okay, hectic lifestyle, premature consumption of the essence. That means if you're not that old yet, nauubos na, you look older now. The earlier this can be detected in young people, the sooner we can institute prophylactic and supporting measures. No? So let us serve the community by making them by preventing them from looking old. Okay? You evaluate the condition of the essence and extent to which the substance has been lost. What do you check? You check the shape of the tongue, as well as the tongue body color and the coating. Now let's go to our example. So here you have a 41-year-old male. 41 is not too old now. Okay. The symptoms, deep exhaustion. What do we mean by this? Even if the patient sleeps like the whole day prior, kulang pa rin, pagod pa rin. Oh, depression. Depression. and backache. Okay. Okay. Background to disease: overwork, hectic lifestyle, emotional problems. I tell you, emotional problems can impact your back. Excessive sexual activity. No, most likely this person has a lot of partners. No? Maybe 3 or 4 partners. Can you imagine? So nauubos yung Jing. Can you yeah. Now let's look at the description of the tongue. So according to the book, it's pale red. So the color is normal. Pale red is normal, huh? But what is very noticeable here is that the tongue is slightly thin. Okay? So what does it mean when the tongue is slightly thin? It lacks nourishment. Okay? So we have here slight spleen chi deficiency. So here it's really thin, thin, thin there. So you have blood deficiency. So then the edges are rolled up here. The edges naka-roll up. When you have that, that is a sign of liver qi stagnation or liver qi constraint. So what happens when you have liver qi constraint? The liver qi is depressed. So when the liver qi is depressed, um, there will be heat following the stagnation. Okay? That's why this one is rolled up. And if you look at the root, it's slightly depressed. So that means there is slight essence deficiency. So there is no heat because the color of the tongue is still normal. Any comments? Madam M or anyone? Did you encounter patients like this? So it is unusual for this patient to be complaining of these symptoms, no? That is why this depression is one symptom that is often overlooked. If you go to a Western practitioner, you will be referred to a psychiatrist, diba? And whereas if you practice what we're doing, you can actually, you don't actually have to look for one. If um if the situation still warrants some treatment. Any comments?
Yes, okay.
Okay. Somebody who would like to react? Okay, let's ask siguro si Sir Jobel. Sir Jobel, may nakikita pa kayo ganitong pasyente na medyo... Let's ask Ma'am Marv from Cebu. Madam Marvelous.
Mayroon po.
Okay. So, pag ganito kanipis, definitely blood deficiency na yan. Okay? So, pag blood deficiency, sino ba nagsusupply ng blood and chi? Hmm?
Liver.
The spleen. The spleen. Kaya automatic
Liver.
yan. Ang liver, nagsusstore ng blood. Ano mangi-store kung wala nga
Ay, oo
blood?
nga pala.
O, diba? Okay, automatic yan.
Okay.
When you see a thin tongue, and then, okay. So, ano ba to? Tingnan nyo ha, automatic yan. The guy is only 41.
The question,
Oh yes, please.
pag, hanapin na pagka blood deficient ba, there's always cracks sa tongue.
No, no.
No naman.
Think of blood deficiency as nourishment. I it's usually the tongue is slightly dry and
Okay.
or thin or pale. No, but this one, kaya nga ang sagot dito is slight lang. But you don't see this kind of tongue commonly, di ba? Very commonly. Okay. So
Malapit na sa
automatically,
malnourished.
yeah. So at the back of the tongue, the posterior third, you would notice na parang ano. Oo. So yun. And I think the emotions, yeah, the letter V shape, depression. So we're still on depression at the root. Okay. Does that answer your question, Madam T?
Yes, doc.
Yeah. Deep exhaustion. What do we mean by deep exhaustion? You're so pagod na pagod. So even if you don't sleep like 24 hours. So even if this person has slept probably 24 hours, he's still pagod. Okay? So
Yan po ba, Dok, yung yung chronic fatigue syndrome?
yes. And walang magawa dyan yung chronic fatigue syndrome is usually the result of a viral infection. Of course, when you are
Oh.
infected by a virus, nauubos din yung chi mo, remember? Naubos yung
Opo.
chi mo because you need to fight off the virus. That's why in Western medicine, when you say chronic fatigue syndrome, parang it's like a wastebasket diagnosis. It's like you got sick before, usually a viral infection, but why are you still so pagod? And it's you've been pagod for, when you say chronic, you've been like having that problem for quite some time. So can you imagine if we could really explore, if we could really check the tongue, huh? Oh, okay. We will not talk about the ear kasi puro tayo tongue ngayon. um, how will I say it? Okay, what do you expect to see on the ear? Nothing significant? Mm-mm. You might want to find yung backache. This may be manifested as yung mga capillary, di ba pag pain, capillary congestion, di ba? Yeah.
Or parang merong bukol sa
May mga bukol.
spine
Yeah.
area.
Um, ano pa ba? So definitely, this patient must probably love to have massage, and usually they prefer deep tissue massage. So that's very, very deficiency. But this is actually a combination of excess and deficiency, which is very common. Excess because we have liver qi constraint or liver qi stagnation. And then, usually ganun, di ba? Paulit-ulit lang. So the spleen is weak, no? Then the liver is qi stagnation. Ako naman usually, I would do the liver excess talaga for initial treatment. In fact, hindi nila alam,
Mm.
pansin ni Sir Mark, yung ano ko doon, yung CAA doon sa Cebu. Oh, kasi I had like 12 patients. So 6 patients on day 1, day 3, another 6. And then he was observing. Kasi siya yung sasalo when I'm not there. Sabi niya do, parang puro cheese stagnation. Para puro liver excess, no? Ano ba yung liver excess points? Kasi impulse niya naman talaga, masyadong excess masyadong matapang. Very forceful. Kasi they're in pain, most of them. Some have emotional issues. So you also have emotional pain. So what I did, ano ba yung excess ng liver? You do lung 8, then liver 4, and then you have heart 8, and also liver 2. Hmm? And then I did, of course, Shanme. And then, so ano na yun? Dalawa-dalawa. Dalawa sa right, dalawa sa left. And pag chronic naman, I would usually do bladder 23 on the ear. And pag malamig yung feeling niya, I would do 4. Ay nako, you should do 4 doon sa likod dito. Kaya when we see each other, you'll be surprised kasi I love doing it. And I think nandito yata si Sir Dennis. Remember these people, sina Sir Dennis, they didn't have any background on TCM, but I think they were able to get what we wanted to teach them. So, yun, sana nag-enjoy sila. Kaya gusto na nilang mag-aral ng CAA. Okay, you're unusually quiet. Nag-i-emote ba kayo or you can relate to this? Excessive sexual activity kasi, this will deplete your Jing. Pag 41 daw dapat, ano lang twice a week or once a week nga lang Yan. Okay? Okay, let's go to assessment. Favorite part. Okay. Let's call on Doc She, who is unusually quiet now.
Dok,
Yeah.
pasensya na po.
Natutulog na. Ay, sorry. Okay, sorry.
Meron kang
Ay, sorry. Okay, can we ask...
alam mo na.
Yeah, sige, okay. Madam T, good na, parang panalong-panalo na yung husband mo. Okay. Madam T, Madam Trixie.
Doc. Yes, Doc.
Yeah, I failed to mention din sa'yo na, pag blood deficiency, di ba blood, minsan nakukulang na yung coating. When you say blood deficiency kasi, that is precursor to yin deficiency. No? What's your answer?
Blood deficiency with empty heat.
Oh, no, it cannot be empty heat because the tongue is pale.
With the
Pag nawala na yung
blood
coating,
deficiency.
when you have blood deficiency, it's just pale. And yeah, so this is like severe blood deficiency.
Severe blood
Kasi
deficiency.
nawawala na yung coating. Because the next step here after blood deficiency would be yin deficiency. Yes? Kaya pag may yin deficiency ka, marami ka ng you cannot sleep kasi you need yin or blood to for the heart. Kasi walang residence yung shan mo pag kulang ka sa blood. Okay?
Yes.
Any comment? Okay, number 2. Madam M. Pale tongue lang sa sides lang. Actually, this is very common, ha? Okay, so ibig sabihin the tongue body color is normal. It's pale red. However, sa sides masyadong pale. So what is your pattern here?
Liver blood deficiency.
Yes, very good. In severe cases, the sides may become orange. I've seen female patients.
Liver blood.
Yeah. So, normal yung kulay ng tongue, but the sides are pale. That's liver blood deficiency. You start asking questions like, do they have scanty menstruation? Or hindi ba monthly yung mens? Ano pa ba? They have also vision problems, no? May problema sa mata. Could be floaters or merong difficulty in, yun. Next, the tongue is pale only in the center. Remember,
Stomach chi deficiency.
I'm sorry? Okay, ganito ha.
Stomach chi deficiency.
No, when you say stomach, you're referring to the coating. Dito, ang pale dito, yung tongue body, the color. Do you get it? So you don't answer stomach chi kasi hindi naman sinabi yung coating. Do you follow?
So, the center.
Yeah.
Pwedeng
Sino ba yung kasama ni stomach?
blood deficiency.
Okay. Di ba, we have learned last time, pag sinabi mong yin or tongue body color, it's usually the yin organ. So what is your answer?
Stomach yin.
No, not stomach. Kasi nga, hindi naman ang
Spleen.
coating pinag-usapan. Spleen?
Ay, spleen pala.
Spleen what?
spleen, spleen deficiency.
Spleen blood.
Clean blood
Blood.
deficiency.
Yun.
Yes. Oo, mahirap-hirap, no?
Hmm.
Number 4,
Spleen
red
blood.
tongue with
Spleen blood.
spleen siya kasi hindi pinag-usapan yung coating.
Coating.
That's na.
Pushing.
Be
Got it.
careful. Number 4, red tongue with coating.
Excess heat.
Yes, or full heat. Full heat or
Full heat,
excess heat. Red tongue without coating.
Empty heat.
In,
Yes.
Empty heat.
Hindi, empty heat. Or
empty,
empty heat with yin deficiency with empty heat. Red
empty.
yung tongue eh. Normal tongue without coating.
Yin deficiency.
Yes. Okay. Oh, number 7. Red spots on the very tip.
Heart fire.
Okay.
Heart fire.
And there is the heart fire derived from
Mm.
emotional stress. Tingnan nyo yung mga stressful nyo. Ay, naku, ang daming ganyan ah.
Mm.
Ewan ko, ako kasi I would know kung mayroong hugot. Ang hirap ituro. Pero I'm sure na-discover nyo na rin yan. Okay.
Paunti-unti po.
Patingin ng dila. Ay, tuwang-tuwa ako niya. Pag nakita ko, may pulang-pula yung dulo. May mga spots. Okay? Heart fire, deriving from emotional stress. The tongue may not exactly be pale. Actually, it's so easy for you to, pag sinabi mo red spots, the tongue may not really be red at all. Okay? Red points on the root. Root of the
Damp
tongue.
heat in the lower burner.
Damp heat in the
Lower burner.
mother or intestines. Oo. Bakit? Because you need to also determine ano ba talaga yung complaint. So if it's a bladder issue, then baka may UTI, no? Pag meron naman intestines, yun. Baka may ibang issue. Red points in the center.
Stomach heat.
Stomach heat. Very good. Ang gagaling nyo talaga. Grabe. And red points in the chest area or front third of the tongue.
Lung heat.
Yeah. Wow. Congratulations. Thank you so much for your attention.